Now, Beijing has passed a new law to protect people who raise the alarm about public health emergencies. Medical workers will be allowed to skip the chain of command and report health risks directly to the local government. Anyone whose tip-offs are verified will be rewarded and won't be penalised. Now, there's been public outrage over the treatment of whistleblowers after a doctor in Wuhan was punished for trying to sound the alert at the start of the COVID-19 pandemic. Dr Li Wenliang, who was among the first to do so, was instead told off for spreading rumours. He later died of the coronavirus, sparking nationwide criticism. Now let's join up with Olivia Xiong in Beijing for more on this story. Olivia, this doesn't apply to all whistleblowers, though.
Yes, Steve. So under the new legislation, healthcare workers will receive a reward and be protected if they were to sound the alarm about a potential public health emergency. But there is a caveat that their intention cannot be malicious. Now, what exactly does malicious entail? There are no further details on that, but the regulations do state that it will not cover those found to be deliberately disseminating false information. Now, that is what Dr. Li Wenliang had been accused of. He had died of the coronavirus, and with his death had come, public outrage and criticism, rare criticism of the government. And that's because Dr. Li had been one of the first to sound the alarm about a new SARS-like virus spreading in the community, and he was one of 8 to be reprimanded by the police for disrupting social order and spreading false information. And he was not the only medical worker to suffer repercussions for trying to raise the alarm. In fact, Dr. Li had shared the information from another Wuhan doctor, Dr. Ai, who had tried to sound the alarm to the hospital about this new coronavirus that seemed to be spreading. And so this latest move is seen to be in response to that. The question is how effective it will be.
And to that point of its effectiveness, Olivia, has there been any challenge to the implementation of this new law?
Well, we have to recognize that this move is part of China's broader efforts to address some of the shortcomings or gaps that we have seen in their handling of the pandemic. Officials have acknowledged that there have been shortcomings in its response. And in May, during China's parliament sessions, we had seen lawmakers call for greater protection of medical workers who had sounded the alarm of potential public emergencies. The government also said that it would grant local disease control centers greater authority to respond early and take action. And last month, we also saw Shenzhen announce a similar legislation to what we're seeing here in Beijing, also protecting non-malicious whistleblowers from any sort of legal consequences. But some experts have previously questioned whether or not this would encourage medical workers to step forward. Now, that's because there may still be some fear if medical workers are unable to prove that the suspicions of a potential public health crisis are actually true and that they could face punishment because of that. Also, the other concern is that it takes time to verify any sort of false claims. And during this time, there could be another disease that is spreading in the community. So some have questioned if all these measures are enough, also given China's rather, top-down political system as well. And remember, China had previously been accused of covering up during the SARS outbreak many years back, and experts had said that, even though China had moved to revise some of its laws and its regulations, the pandemic this time round, the COVID-19 pandemic, still revealed many gaps in the system.
Olivia, thank you very much for giving us some context there to this new law passed in Beijing to protect people who raise the alarm about health emergencies. Olivia Xiong there reporting for us from Beijing.